Welcome to this instructional video on fine needle aspiration. In this short guide, we'll walk you through the essential steps, preparation, handling and transporting of FNA samples. Before you begin the procedure, have all the necessary equipment ready. It is recommended to use a 25 gauge needles and a 10 ml Luer lock syringes. You will also need a tray to transport needles around the room. Prepare frosted glass slides, each clearly labeled with the patient's full name, date of birth, sample type, laterality and number of the pass. You'll also need one unlabeled slide to act as a spreader. Ensure you have a universal container filled with cytology preservative fluid. If microbiology or immunology tests are required, have a separate empty universal with a couple of milliliters of saline ready. Also make sure you have a slide carrier and specimen transport bags. Once the sample is collected, push a small drop of material from the needle onto the labeled slide. Try to locate it centrally, in the top quarter of the slide. Use the unlabeled slide to gently spread the sample, creating a thin, even layer for optimal analysis. Then, flush the needle several times in cytology fixative fluid to preserve any remaining material. Dispose of the used needle and syringe in a sharps bin. If you require micro or flow, take an additional pass and flush the needle with saline. Before sending the sample, ensure the spreads are properly labeled and fully dry. Check if there is any material left on the spreader. If not, discard in the sharps bin. If there is material, label it with patient's identifiers and put in a slide carrier with the rest of the slides. Print the labels with patient identifiers and the barcode and put it on the cytology pot. Place the pot and the slide carrier in a specimen bag. Ensure the bag is zipped securely. Putting absorbent pads in the bags is recommended to prevent any possible spillages. Print the request form and put it in the outer pouch of the specimen bag. Then put all cytology samples in cytology transport bag. If you have collected any additional samples for microbiology or immunology, label the container with an appropriate label and place it in a separate specimen bag. Following these steps carefully will help to ensure high-quality samples and reduce the risk of processing delays. For more information, check our user manual or consult with diagnostic cytopathology team.